So the number one thing I want to tell you about, so it would be my tip number one, is when you go to your clinical, be familiar with the site that you're going to. So obviously you're going to want to be familiar with their protocols, the way they go about things. That will probably be discussed with you. The kind of population you're going to be working with. So obviously, especially in the very beginning of nursing school, you're likely going to be starting with long-term care. So you're probably going to be at like a nursing facility. So you're going to be with a population of people, most people that are elderly, that are a lot older. So you're going to have to then think of kind of like what you're going to do with these kind of populations. Making sure you know the policies, procedures at these facilities as well, just like you would at the hospital. What you're going to be working on, like what kind of things are going to be expected of you at this particular clinical. So for like long-term facilities, especially since it's the beginning of nursing school, you're pretty much just going to be doing head to toe assessments, giving medications, maybe doing blood work, or not blood work, but blood pressures, anything like that. So being familiar with what you're going to be doing at this facility. So getting familiar with the facility, where things are at is important. So if you need supplies, where they have supplies, the nurse that you're going to be with that's going to precept you at this particular facility. Just you want to be familiar with a lot of that kind of stuff whenever you go to do a clinical, whether it's at the hospital, long-term care facility, clinics, wherever you're going to be. Make sure you're familiar with all of that, okay?
Hey everyone, if you enjoyed watching that clip and you want to see the full video to it, make sure you guys click the box here. If you enjoy watching these kind of videos and you want to see more videos from the Nurse Kristen YouTube for pre-nursing, nursing student, new grad nurses, make sure you guys hit the subscribe button over here.